Hi you guys, and welcome back to my channel. I recently had surgery to get my fibroids removed, so this is my fibroid story. I got diagnosed with fibroids back in spring of 2022. I noticed that at one point there was a big giant lump in my lower abdomen. I noticed that it felt like someone was stabbing me in the stomach. I was constipated for a week and I was having spotting. So I had 2 x-rays. I had to rush to the doctor. I discovered that I had fibroids. The doctor said that I could try to just live with them and just try to eat healthy and live a healthy lifestyle to manage them. And at first I did that and it was going okay, but then later on, the symptoms of my cycle became unbearable. The really heavy blood flow, the big giant blood clump, big giant clumps of blood, massive clumps of blood would come out of me. The cramping was insane. I mean, the symptoms were the worst just the first 2 days, but the point is that the symptoms were just too extreme to deal with. So I decided that it was time to go ahead and get the fibroids removed. And so I started the whole process, I want to say maybe earlier this year. I've had like a bunch of different doctor's appointments that I had to attend. And so I scheduled the appointment to have the surgery over the summer. Turns out that I was no longer a candidate for a minimally invasive surgery because my fibroids were the size of a 5-month-old fetus, so I had to have an open surgery to get them removed. So I had a vertical myomectomy, which I guess is a C-section. I couldn't have a horizontal one because the fibroids were really big and they were pushed up, like up in my abdomen. There was a big giant one behind my rib cage. And so the doctor said that she would be reaching high within my torso to be able to get all the fibroids out. So it makes sense to make a vertical incision rather than a horizontal one. And I read that the vertical incision was going to be difficult to recover from, being that the nerves in the abdomen run horizontally. But my recovery actually has been going fantastic. So I've got some pictures and videos to show you. The picture at the top is what my abdomen looks like when I eat too much sugar, and the picture at the bottom is what it looks like when I haven't eaten very much. I am convinced that fibroids come at the result of your diet. The picture at the bottom was taken a few days just before the surgery. During the lockdown, I overate and binged on desserts as well as fast food. And after doing that for 2 years, I later on found out that I had fibroids. And I'm pretty sure it was my eating habits that caused me to develop fibroids. And I'm mad at myself because I lived a fit, healthy lifestyle for 10 years. And so I was someone that knew better. The picture at the left is what my stomach looks like. That was what my stomach looked like the morning of the surgery. That's basically what my stomach is going to look like when I'm 5 months pregnant. My friend said to her my stomach looks normal, and I'm like, maybe in a sense, but for my size and my body type, I mean, my stomach has been swollen for about 2 years now. The picture on the right is what my stomach looked like 1 week post-operation. It's slightly puffy at the bottom because there's a balloon down there to help with the scarring within my uterus. But for the most part, I lost weight immediately. This is me a month before the surgery, and if you look closely, I do look pregnant, even though it's not super noticeable because of my physique. In this picture, they were pumping me up with painkillers because they try to get ahead of the pain right before they send you into surgery. So they were giving me painkillers, and I felt relaxed because I was excited to have the surgery done. So right after this, they put me under anesthesia, and then I woke up to what felt like literally a minute later. It felt like a minute later, but it actually took 4 hours. I woke up shivering and in severe pain, and they were covering me with blankets. I was being silly here. Every few hours, all night long, they brought me painkillers. This was breakfast the next morning. It was plain, and it was actually delicious. The medicine made me feel kind of nauseous, so I couldn't eat anything with a lot of flavor in it. And this was lunch, very plain but filling. The hospital was New York Presbyterian, Bronxville. Because I was able to get up and walk out of the bed and go to the bathroom by myself, by the next morning, I was walking hunched over, but I could walk. So my friend came and checked me out, and we took a medical cab back to my apartment. I live on a 5-floor walk-up, so I tried to see if I can get an ambulance to take me back to my apartment, but they were able to see that I was able to get up out of the bed and walk around without any problems. And I told them I live on a 5-floor walk-up, but actually I was able to get up the stairs just fine because I didn't engage my abs going up the stairs. I just had to strictly use my mind to keep all of my balance within my legs and not use my abs at all. And so I was able to make it up the stairs the next day with no problems, and I got right in the bed. I was on several different medications, ibuprofen, oxycodone, acetaminophen, as well as estrogen and some other hormone medication, as well as antibiotics. When I first discovered I had fibroids, I researched the symptoms and I concluded it was either fibroids or endometriosis. That's what I concluded. It's either fibroids or endometriosis. And the doctor said when she was in there taking out the fibroids, she noticed that I also had endometriosis. So I have both, and the hormone meds help with managing both. I know I look so goofy just smiling in the camera like that, but I really was in pain. I had to take my meds. I had to set my alarm clock and take the pain meds every few hours because, the pain meds helped a lot, but I was still in pain. You see all my medications right there. I put everything right next to me, and I was in pain, but the pain meds helped a lot. My stomach was pretty much flat as soon as they took the fibroids out, and remember, I lifted weights aggressively and ate healthy for 10 years before having fibroids, so my stomach just reverted back to the way it was before. The doctors and the nurses commented that it does not even look like I have fibroids, and that's true because, I'm naturally really tall and slim, so it wasn't super visible, but this was what was in my abdomen. Two of those medium-sized ones I knew were in there. I didn't realize that there were that many in there, and I had no idea that big one was in my stomach. I bought a few C-section items off of Amazon to help me, including this grabber. It was helpful the first few days, but then later on I didn't need it and I returned it. So I ordered different stuff off of Amazon to help me with my recovery. I bought MiraLAX, and I'm going to link all this stuff in the video. I couldn't poop for a week, but after taking the MiraLAX, I was able to poop, so I do recommend that you buy this. My brother suggested that I buy Dulcolax, and I bought it and I ended up not needing it because the MiraLAX worked, so I got a refund on it. I also bought this medical tape to help me with taping the gauze onto the incision, when I needed to do that. I ended up not really needing this. I forgot I already had some. I also bought these C-section underwear. They were very comfortable and very sturdy, but I ended up not needing them, so I got a refund from Amazon for them. I do recommend that you buy this pillow. I mainly needed it the first few days, but with the recovery later on, it's still pretty helpful. I recommend you buy this. And also this heating pad is very helpful. This helped me particularly the first few nights, which were really rough. It does keep you warm, and I think I'm gonna hang on to this heating pad, and I think you should get one. This is what the incision looked like 2 days after surgery because I misread the directions and I took off the dressing. I took off the top and bottom layer of the dressing. I was only supposed to take off the top layer. As you see, it ripped off some of my skin. And so that was just my mistake. And I said, OMG, I'm sitting in my apartment with an open incision. But at the time that I did that, my friend who's a nurse was on her way over to my apartment, and she stopped and got some steri strips and taped everything back up. And so everything was fine. There was a Foley inside of me, which is like a kind of a balloon to stretch out my uterus while my uterus is healing so that it won't heal constricted with scar tissue. This is the end of that Foley. This end, I believe, is called the catheter end. That was originally inside of me, but my body kind of pushed it out. So I have to always hold that end in an upright position when using the bathroom, as well as when I'm done showering and I'm getting dressed. I have to hold it like between my legs in an upright position because if I don't, blood and discharge kind of drip out of it. So I'm glad that I'm finally getting this removed. I am getting the Foley removed tomorrow. Looking forward to that. So this is what my incision looks like 2 weeks post-operation. I know it looks really bad right now, but I'm healing. I know, yeah, I do shave my stomach, but just because of, everything's still healing, I'm not gonna shave it right now, obviously, because it's healing. But this is the incision. This is 2 weeks post-operation. These dark spots, the medical tape that they use to tape on the gauze, when I pulled it off, they said to take it off after 24 hours, and I did. And as you see, it ripped off some of my skin. So my stomach looks really jacked up right now. You see how it's kind of shiny? That's because it ripped off some of my skin. And it ripped off some of my skin on my arms too. I think you can see that. Ripped off some of my skin. And here too. As you see, it didn't rip my skin off, but it kind of agitated it. I think it might have ripped off a thin layer of it. So that tape was like extra strength. But anyways, the incision, it doesn't hurt. Like it was itching, but I put some Benadryl extra strength anti-itch cream on the incision, like right here mostly. And then I put a little bit on here and it did stop the itching. Here's a close-up. I know it looks really bad, but I had a C-section, so don't judge me. It's currently healing, and once everything's all healed up, I have different products that I can use to like even out my skin tone. Oh, also, there's a balloon in my abdomen to stretch out my uterus. And you can see it. You can see that little bulge. That's the balloon that they put in there. There's a balloon in here to stretch out my uterus while the uterus is healing, because there's going to be some scar tissue on my uterus, and I do want to have children, so it needs to be big enough to be able to hold babies. But if it heals with scar tissue and it heals constricted, it's not going to stretch the way it's supposed to be able to hold a baby. I think that's the way the doctor explained it. So that's why they have that balloon in there. And the balloon has a catheter hanging out of it, and one of the ends of the catheter doesn't have a cap, so it does leak fluid, like blood as well as discharge. So I have to just make sure when I use the bathroom I hold it, and then if I'm going out somewhere I have to wear a panty liner with it, because it does leak just a teeny bit of blood and fluid. But I'm getting the catheter removed on Thursday, which I'm happy about. I have little to no pain. Sometimes if I sleep in a weird position or something, I might have a little bit of pain and I have to take ibuprofen and acetaminophen. But for the most part, I don't have any pain and my recovery is going extremely well. I might go back to work in a week or two. I would love to take the whole 6 weeks off, but I'm broke, so I have to go back to work, unfortunately. I might go back next week, but I'm gonna try and work from home full time. But I am having a fantastic recovery, which I didn't think I was gonna have. And I'm just so pleasantly surprised to see how well my surgery is going. I honestly thought I would be bedridden for like at least a month. I mean, I felt fine to go back to work after a week. The only reason why I didn't go back immediately was because I still have a lot of phone calls and appointments, like post-operation appointments. I've gotten phone calls from the doctors, from the nurses, from my primary care provider, from the social workers. They want to make sure that I'm healing okay. They want to make sure that I'm not depressed. I have a friend that comes over, has come over and helped me around my apartment the first few days. I really only needed help the first few days. Like, she went and got my medication for me, and I'm so glad she did, because I would not have made it through without those payments. Again, it's just the first maybe 3 or 4 days that are rough. After that, I didn't find the recovery to be horrible. So I feel great. Yeah, don't do anything strenuous. Even though you feel fine, you're still all chopped up on the inside, so take it easy. I'm having a really good recovery. I'm honestly surprised at how great my recovery is going, but it's going fantastic. My cycle started the day that I had the surgery, and my cycle is lighter already. Like, it's immediately lighter. I don't have any heavy bleeding. I didn't have any cramps because of the pain meds. I didn't have those huge clumps of blood that I've been having the past 2 years. I haven't had any of that. Like, everything has gone back to normal, and I'm just so happy. So I'm so glad that I had this surgery, and if you're thinking about having it, you should probably have it. My friend said she's thinking about having her surgery. I mean, I feel great. So that is my myomectomy story. If you've got any questions, please let me know. Thank you for watching. Bye.